Thank you very much for your kind invitation. I'm honored to share with you what little I know about responsible conduct of research. My name is Tashfeen Ahmad. I'm an orthopedic surgeon working at Ahmad University. I've been involved in training and research for quite a while, and also the ethical conduct of research. So my talk on responsible conduct of research uh, is based on several of the ethical principles which guide the researchers to perform their research appropriately. So before we start, I would like you to give me your thoughts on what is research ethics. Going to this Menti site, please go to www.menti.com and use this code 48225771. You're going to see a slide on a question, and please answer your question briefly. We'll just spend 1 minute on that so that I have an idea as to what are your thoughts on this particular subject. Yeah, you can mention words or short phrases up to 3. And I'll get to that in a while. All right, I'm going to show that slide in a while. First, I want to move on with the presentation. Here is a case. So if there's an elderly man who has terminal cancer, and he reads on the internet about a research going on, and in that clinical research, there is a new experimental drug for the cancer that he has. So he approaches his oncologist who's treating him and tells him that I've come across this from the internet, and this treatment is a wonder drug and it is going to save my life. And he wants to enter into the trial, the clinical trial, and expects to be completely cured within 6 months. The oncologist tries to tell him that the benefit from the experimental treatment can't be predicted with any certainty. It isn't expected to prolong life by more than a few months. And the chances of his being completely cured by it or anything else are close to 0. That's what the oncologist's knowledge tells him, and that's what it tells to the patient. But the patient continues to insist on enrolling for the trial with the above mentioned understanding in his mind that the treatment will save his life and he expects to be cured within 6 months. So you can think about what ethical issues could arise. So feel free to write on the chat box if that is enabled. Then do feel free to write on the chat box what you think are the ethical issues in this particular scenario. Write short words or sentences. Yes, that's enough, right? And we're going to come to that. So quite often when scientists who are starting their career, they come across ethics, it is because of these reasons. That they submit an article to a journal and that tells them, please bring us an ethics committee approval. The trainees who are in the clinical training programs, the residency programs, they sometimes are asked by the CPSP that they need to submit an ethics approval from their institution. Your institution may require you to have an ethics approval before you start any research project. But what I would like you to understand is that it is our professional responsibility to ensure ethics in our research work. And even the Pakistan Medical and Dental Council, which was its previous name, now it is the Pakistan Medical Commission, they are still following the same code as the PMDC. And I'll show you the code that is binding on the physicians, on the medical doctors and the dental doctors, that they perform research in a particular way and avoid some things which people can do in research, which would not be ethical. So that's the responsibility that we have. So adhering to ethics is our responsibility, and with that responsibility, we respect the patient, we protect them from harm, we ensure that they get the benefit that they deserve, and the society overall benefits from the research work. So that's the idea of responsibility which a researcher owes to the society. Okay. You could be practicing ethics because of these requirements by the different institutes and the agencies. On the other hand, you may just want to be an ethical person because that's what you are, right? So it may be driven by your internal values. For institutions, I would challenge you to say that having an ethics process and making sure that all the processes of research are compliant with all the different requirements which ethics has, that makes business sense. How could it make business sense? It makes things more cumbersome. It makes it a bureaucracy. It makes the paperwork longer. Time processing, approvals, getting one approval, another approval, this review, that review. Then you get comments, and then you write response to comments, and then you get another response to your comments, and then you address those, and back and forth things can go. Some of you may have experienced that. So does that make business sense? Business sense is that everything should be efficient, as fast as possible. Get your clearance, do your study, publish it. But that's not what, that doesn't make business sense if it doesn't follow that part. When you are practicing ethics, the research in an ethical way, people start to trust you. The researchers community starts to trust you, your stakeholders, which may include your patients, the institution's patients, the hospital's patients, the community at large, the different academic people who are associated, the industries which are associated with your institute, they all start to trust you more and more if your processes have ethics inbuilt in them. So in the short term, it may appear that you're making things more cumbersome, but in the long term, you earn your reputation, you earn the trust of the people, and that is a positive for the business sense in the long run. What is happening in Pakistan? This is where we live in. We face poverty, we face lawlessness, corruption, we face violence, we face disasters, and in the setting of a large population with a huge disease burden, with a tremendous need for medical research and a need for ethical conduct is correspondingly high. So definitely there is a need for practicing ethics in Pakistan. There are many reasons why people may breach ethics also, right? So what do people expect from us now? If we are a community of physicians, surgeons, doctors, or dentists, or even nurses, those who are associated with the practice of medicine, they are considered to be in a very noble profession with high ethical standards. People expect as a degree of selflessness, that we care for others more than ourselves, right? And we are considered as professional role models in whatever we do. Our day-to-day routine is expected to reflect our professionalism in all aspects of our dealings with people. So they expect us to be role models. And for us, the patients come first instead of our own benefits. Okay. So if you look at the code of ethics, this is a sample of that, is also available on the net. This was the old website, pmdc.org. Now this website doesn't exist, but you can search for the PMDC Code of Conduct, you'll find it, this document somewhere. So that has a section on research ethics and consent. Now this code is binding for licensure, okay? Whoever is licensed to practice medicine and dentistry, they are supposed to follow it. So it's essentially a law. That mentions not just how you practice your clinical work, but also how you do research. So for example, they clearly say that ethics review committee approval is required. It mentions that a consent has to be taken. It mentions that if there are vulnerable people in your study population, you need to protect them. It mentions that the investigating team has to have competence. They need to be certified, educated, they have to know what they're doing, right? Then there has to be privacy and confidentiality, which needs to be assured. So all of these things are mentioned here in the code. So these are the laws that we need to be following. Okay. So in the responsibilities for the researchers, privacy and confidentiality, our own competence, protection of the vulnerable, consent process, and approval before starting the research project, they are all there. Okay. So this forms the foundation of our responsibilities in Pakistan. And in most other countries also, the responsibilities are similar. So question arises, what is consent? If we want a consent, how do we take it? Now this person who I gave the example of, how do we take their consent? They want to enroll. Do we just give them a form and get it signed? Are they really comprehending the nature of the research? So if it appears to you that they are failing to comprehend the nature, then you should suspect that they are not really competent to give their own consent. So what I'm saying is that anyone who says he wants to enroll is not automatically assumed to be okay to enroll. You may have reason to deny their inclusion if you think they're not competent. Whether they're not competent because of old age or not, mental issues, comprehension issues, or they're too young, even children, right? Children, we don't take consent, we take assent from children. For those who can understand, we explain to them. And the consent is from the guardian, who would be the parents in most situations. So from them, we take consent for including their children. But we try to explain to them as much as they can understand. Elderly also we can try to explain, but sometimes people may be too old and may not really understand. Some may have mental disorders, mental disabilities, and they may not be able to understand. So they are not competent to give consent. There has to be a surrogate who needs to be engaged for getting or performing any research on them. Right. So people may appear to be competent like this person, but if they're failing to to comprehend, then we could deny that if we feel that they are not understanding what we're trying to tell them. Vulnerability. Now, this is an important point, that these people who have terminal illness, they are grasping for straws because they know that there's no treatment. So if there is a hope for a possible treatment through research and experimental drug, why not try it? That's what they're hoping for. But even then it becomes unethical to include them if they are believing that it will cure them. That's the unethical part. So investigator, you as an investigator should not be fulfilling your research requirements by recruiting people who have a misunderstanding about your research, right? So the information needs to be adequately shared and it has to be ensured that they understand it. So it's not just a matter of giving a form and getting it signed. Its consent means that you explain everything to them. That's the informed part, including the risks and the benefits from whatever empirical knowledge is available. So based on that, the person should make a reasoned decision based on that evidence. But if they appear to be ignoring all those other facts, that means that they're failing to comprehend. So that's the information part, and then the consent form, which is the legal requirement of getting it signed and giving one copy of that signed form to the participant and keeping the other copy for your own study folder. So there has to be two copies. One they keep, because it's a legal document, both have to have a copy, right? Competence is the ability to understand relevant information, evaluate, to make a reasoned decision, and to decide without influence, and to communicate consent or refusal. So the researcher's responsibility is to make sure that whoever is consenting is competent to give the consent. So how do we ensure that ethical principles are followed? Autonomy, which is respect for person, beneficence. The autonomy part includes this consent part. This is one of the aspects of autonomy. Okay, that you're giving them the right to decide if they want to be included or not, whether they're a prisoner in a camp, whether they're a diseased person in a hospital, whether they're a mental home occupant, or whatever they are, whether a child, whether it's a pregnant lady, whoever is there, whether a student, subordinate, they have their own independent right to decide if they want to be included or not. That's autonomy. Okay, so you respect that person. They have the right to withdraw anytime they want. They have a right to be treated for any complications that arise from their study. If you treat them with some medicine and they get a heart attack, who's going to pay for that? Do you expect them to pay themselves? No, your study is supposed to pay for it. Anything related to your study which causes anything should not be borne by that person. That's the ethics part. Beneficency. There has to be a good evidence that the study may lead to benefit instead of harm. So you have a judgment call. Compare the evidence for and against the benefit versus harm, which is a non-maleficence. Don't do no harm. Justice. That if you have something available, you will give it to them. If your study participants have contributed to your research, it should not be at the end of research you produce a new drug which has been proven useful based on research on this particular population, but you make it available at a very expensive price which this population can't even afford. That becomes unethical. So there has to be some distributive justice. So access to is also supposed to be distributed. You don't want to conduct your study only in males. Are you excluding females? You don't want to include only one class or one race, right? So if other people also can get that disease, then they should also get the benefit. So that's the distributive social justice part. So how do you get these guidelines? How do you come to know what is appropriate to do? What responsibilities I have as a researcher? CIOMS was an international institute which WHO had established, and they say that before understanding research, investigator must make effort to make sure that research is responsive to the health needs of the population or community in which it is to be carried out. You don't want, for example, a European company to do research on a disease which is prevalent in Europe and conducted the research on Pakistani population where that disease is not important. They may want to do it because it may be cheaper to do it. It may be easier to get the study done, but it is not helpful for the local population. So why should they participate? And any product developed should be made reasonably available, right? So then this another guideline, GCP. It stands for Good Clinical Practice. You can search for it, GCP guidelines. So most clinical research institutes require people to be trained in GCP. Okay, it's available as an online course also through NIH websites. GCP it's free, and our Aachen University offers this as a course from the clinical trials unit also. It's a very nice interactive workshop which whoever is interested in research should really attend. So there's a certified course which Aachen University also offers. So they have 13 core principles. Declaration of Helsinki is one of the landmark documents of research ethics. So that has to be complied with. This is the first principle. Then favorable benefit risk ratio, subjects' rights have to be protected, supporting data has to be there, the protocol should be scientifically sound, ethics committee has to oversee. If there is any medical care required, then there are qualified medical personnel who can provide that care, right? And the researchers and the team has to be qualified, consent has to be taken, records have to be kept, confidentiality maintained. If any product is being developed, then that has to comply with good manufacturing practice guidelines. Okay, so those are international guidelines, GMP guidelines, and then the quality assurance mechanism has to be there. Who needs to comply with these? You, if you're an investigator or you're a research officer, the nursing or other staff, they need to comply. There are sections which are relevant to all of these categories: study coordinators, ethics committees, CROs. Sometimes funding agencies don't give funds to agencies if they don't agree to comply with the GCP requirements. If one doesn't, what can happen? If it doesn't comply with ethics, what can happen? Ban on research, withdrawal of publications, career impact on the individual, impact on the institution. There are punishments which are given to people who don't comply with these good clinical practice guidelines. If they breach ethics, they would be breaching their own institutional laws. So that has to be avoided at all costs. So there are some other ethical issues such as misconduct, which includes deception. In consent, it is very easy to deceive a person into believing that this is good for them and they start enrolling it. So you have to be very, truthful about everything in the consent process. Plagiarism, fabrication of data, falsification of data. You get a positive result, make it negative. That's falsification. You don't have data, but you show that you have data. That's fabrication. Plagiarism, somebody else already did it and you're showing it as your own work. Plagiarism. Deviation from protocol. You said you're going to give anesthesia locally and you end up giving it regionally, or spinal anesthesia or something like that. That becomes a protocol deviation. It's misconduct. Ghost authorship. Somebody was supposed to be an author, but they're not. You excluded them. Gift authorship. Somebody who doesn't deserve to be an author, but for many reasons, usually political, you make them an author. So those are considered as ethical issues. So those need to be addressed. Animal research, there are guidelines. Public health research, there are guidelines. So all types of research which you do, there are guidelines for how to be responsible. So in summary, there is a need for ethics in research. It's an expectation from our profession. Autonomy, beneficence, non-maleficence, and justice are the main principles which are applicable throughout the principles of and consent, vulnerability, and exploitation are particular things which you need to pay attention to. There is a regulatory framework in Pakistan, the PMDC code that I showed you, and there are many sources for you to get further information. Your own institutions' laws, ethics committees' laws, European Commission has their own guidelines on ethics, and CIOMS I've told you, and GCP I've told you. So those are the guidelines where you can get further information in it. So these links are available online. Even a free text Google search can guide you to these things. The last one is a book which mentions these 4 principles of ethics in quite detail. That's a very good textbook for people who are interested in ethics. So thank you very much. That's what my presentation is about. So I will quickly go over to this slide. Where is it? Just want to share what you heard people said. What term comes into your mind when you hear researchers? Confidentiality and transparency, truthfulness, safe practices, accountability, informed consent, honesty. Perfect. I think you people are marvelous. You have really written the core of what I wanted to cover, and this is exactly what is the responsibility of us as a researcher to ensure that all of these things are followed. Perfect. Excellent. Thank you. So this is another question which I have. If you want, you can do that. If I don't know, the organizers, I think we are running over time. What would you like me to do now? So this is a question that, if possible, they can answer, and then we can close. Go to the same link. Very interesting. Yeah, sometimes people don't follow the proper process, they don't take a proper consent, they try to fill up more and more. Sometimes they grab other people's work and publish in their own name. Sometimes they want their name put, but they don't deserve. Why do people do that? The idea is to sensitize. Now that you know about it, I expect that at least you're not going to do that, right? So let's hope for the best. And these kind of, you may see these things happening around you. Sometimes, somehow you have to resist doing it yourself and also try to correct the people who may be doing it or planning to do it. So those, you need to really guide them somehow politically, of course. This is a very sensitive matter. Sometimes people get offended. Sometimes your seniors may be doing something like this. And you may not be in a position to challenge them, but staying silent is also not an answer. It needs moral courage. The term we use is moral courage. It is stand for what is right. It may have repercussions on you, but if nobody stands up for it, wrong will perpetuate. So get help.